Okay.
Hello, everyone. Back to Frontrunners Innovate. We are, and oh my goodness, we're in Africa today. So we are in Ghana and Zambia, and we have with us, of course, lovely Mary Chirwa. And I always love to bring youth aboard and get a perspective that we don't often get to hear from in the innovation world. And so we are so blessed to have you, Mary, to join us today and to spend a little bit of time with us in an area that really interests you. So I'm tickled for you to share a little bit about yourself. So please introduce a little bit about you, your background, where you went to school, and what your interests are moving forward.
Thank you. Thank you, Mary, for having me today on today's podcast and allowing me to co-host. So my name's Mary Chira and I'm from Zambia. I recently completed my grade 12 at Tasisia Florian Secondary Boarding School that's in Solwezi. And I'm passionate about dentistry, of which I want to venture into oral health when I finish school and then go into oral surgery. And I'm currently working on a book, Faith and Dreams, that's currently under progress. Thank you.
Wow, lots of ambition going on there. I like it. I like it. I like it a lot. This is great. So, Dr. Emma, I'm just going to call you that because we've already done our little introductions here. So, Dr. Emma, share a little bit about your background for us, please.
Okay, thank you very much, Mary, and Mary as well for having me on this podcast. I'm really excited to be here today. So I'm a multi-award international dental surgeon with over a decade of international experience that spans across 3 continents, so Europe, South America, and Africa. I've always been very passionate about dentistry growing up, and I'm very happy to be doing what I'm doing today. Thank you.
Fantastic. Well, one of the big reasons that I wanted to pull you in and put a spotlight on what you're doing is I'm drawn to people who are innovative and who take what they're doing to a bigger level and start solving some problems. And you've done that. So you're not just what I would call a dentist. You are a dental businesswoman. You are a medical businesswoman. So tell us what you've done with the skill sets that you realize that you have. Where's the turning point from being a professional in dentistry into entrepreneurship and doing the good work that you're doing and setting up dental clinics and other things around the continent?
Good. So like I said earlier on, I've always been extremely passionate about dentistry, and I started in a small clinic in Brazil before relocating to Ghana. So in Ghana, I co-partnered with a friend of mine to establish the All Smile Dental Clinic. Okay. So we started from one dental practice, and with perseverance and determination, within a year, we managed to set up 2 dental clinics, right? And so the standard of our clinics is such that we provide top-notch services, and also our clinics are very beautiful. They are very comfortable, because a lot of people have phobia when it comes to dentistry. So I wanted to create some kind of ambience whereby when people come in, they feel comfortable and relaxed in a very zen mood, so that they can be seen diligently, okay? And so when I moved to my second clinic, people come, especially colleagues, so they come see the decor and they get enthusiastic about it. So they keep asking me, Emma, how did you do it? Can you help me set up my clinic as well? So then I decided to turn this into a business, right? And so we started with a practice, I think my 3rd practice in a place called Chado. Now, before we set up our clinics, what we do is that we do a very extensive research, right, because at the end of the day, the practice has to be profitable. And so we ensure that wherever we're setting up, it's at like an accessible area, whereby you get a lot of people, seeing the clinic, whether they're on foot, whether they are driving by. And so it helps to market and advertise the clinic as well, because remember, even though the aim is to provide top-notch services to patients, it also has to generate revenue, right? So you need to ensure that there is an equilibrium and a balance between the two. And so to set up clinics, that is of paramount importance. The location matters. You need to ensure that you're setting up in a very strategic area, right? And then also what we do is that besides setting up, we also ensure that our decor is something to marvel about. Our clinics are very beautiful. And so, I mean, you have to check them out on our Instagram page, but very, very calming. And what we do is that when our patients come in, right, there is a whole lot of things that we do for them. But, well, let me move to the entrepreneurship part of it. So colleagues asked me, do you know what, can you set up a clinic for me as well? So I decided that I'm going to turn this into a business. And so I set up a clinic for a colleague of mine. And then from there, decided to, venture more into this. And so from dental clinics, we started setting up dialysis centers. We're actually looking at a pharmacy as well, right? Which is also not a clinic, but it's also something which has got to do with health. So we're setting up a pharmacy and also hospitals. So now the ambition is to go into hospitals. So it's not just dental clinics, not just pharmacies, but also into a whole hospital. And I'm not just looking at Ghana or Africa. We going across the globe. So we've got opportunities in the Caribbean. We've also got opportunities in the UK and then in Italy. And the reason why I'm very passionate about this is that it's not only because of the profit aspect of it, but also to help people, because I'm very passionate about helping people as well. And so for people or for dentists, right, who do not have the money to set up their own clinics, what I do is that once it's set up, I give them a financial plan. So payments can be done in installments so that it's comfortable for them. I mean, owning your own practice is a different ball game. When something belongs to you, I mean, you are very enthusiastic about it, right? So I give them the opportunity for them to own their own clinics. And people who wouldn't have been able to have their own clinics now have the opportunity to be entrepreneurs as well. So I'm creating opportunities for other people as I move along my path. So what I do is that we set up clinics and for for dentists, for health professionals, but also for businessmen. What started as setting up for just dentists or health professionals are turned into businessmen, because the businessmen, most often at times, they have the money, but they don't know where to invest the money into or what to invest the money into. So that is when I come in and I tell them that, you know what, there is good return on investment if you invest in a health facility or in a clinic. And so business people are really patronizing, and it's amazing. So what I do is that it's not just the setting up of the facility and then just handing it over to you. We also ensure that you have good staffing. So from receptionists to dental surgeons to dental assistants, and then also to help with documentation. So we help you with for example, a country like Ghana, when you're setting up a clinic, you need something called HEFRA, which is a certificate or license for the practice to function. So we help you to get all the licenses and documentations needed. We also ensure that there is good marketing and advertising structures in place. We also ensure that there is good financing or account management, right? Because we don't want you to we want you to thrive and be able to succeed, right? So we also ensure that all these little things are put in place so that your clinic that has been given to you thrives for you to make good returns at the end of the day. So we look at the different things that helps you to thrive and to flourish in owning a practice.
That's fantastic. That's a lot. And I do remember you telling me that you like to get students right out of the university, because otherwise they would be sitting around doing nothing for a while. And I wonder if Mary has any questions around that as she's approaching maybe advancing her career in that space. Mary, tell me what you've got going on. What questions might you have?
I only have one question. Yeah, and the question is, Dr. Emma, what inspired you to become a dentist? Was it through pep talks during school, during career talks, or it was just something you wanted to do as a child? And how long did it take you to reach where you are today? Thank you.
You're welcome, Mary. So my journey into dentistry started quite young. I remember when I was very young, I think around 8 years of age, my dad took me to the dentist, right? I had I think a tooth decay. I was terrified when he was taking me there. But interestingly, when I saw the dentist, she was female. She was so calm, very collected, and I just loved her straight away. And so the treatment went on really well, although I cried a little tiny bit. The way she talked to me made me really calm, and I was able to have the treatments done confidently. So right through that interaction, then I started having passion for dentistry. So, and yes, so the journey hasn't been easy, but I believe that in life, with discipline, right, with commitment, with diligence, determination, hard work, and faith in God, there is nothing that you can't achieve. So I got a scholarship, right, right after school, to study in Brazil. So I started from Brazil, then I went to the UK, and then after that, I did specialty courses as well. And in between, I always worked. So even though I was like, let's say in first year, for example, I wasn't just learning, I was also observing. So I used to go to other clinics to serve. I could even work as a dental nurse just for me to be within that environment to experience, because I feel like in life, it's always good for you to have that experience as well. So right from first year of school, I used to go to clinics, observe, experience, interact with both the staff, other dentists, and patients, right? And it helped tremendously. So it's helped me to get a very clear knowledge and opinion and experience once again as to what this dentistry is really about. So it hasn't been just straightforward. It's been it's been amazing, but it also has its ups and downs. When you're in school, for example, dentistry is not just about studying the mouth, right? There is a direct correlation between oral health and then the other parts of the body as well, and your general well-being. For example, problems in the mouth can give you problems elsewhere, right? There is something called calculus in the mouth, right? When it's not treated, it can give you all sorts of issues. And bacteria from the mouth, for example, can get into your heart and cause what we call infective endocarditis, what is the destruction of the heart valve, right? And also bacteria, again, there's an ongoing research into bacteria getting into the brain to cause dementia, from the mouth to the brain to cause dementia. It can also cause infertility, erectile dysfunctions, and so on and so forth. And the same way, problems elsewhere in the body can also give you problems in the mouth, right? For example, if you are diabetic and it's not controlled, you're not on any form of medications whatsoever, you could have bleeding gums, you could have problems, you could have periodontitis, that's problems in the mouth, the teeth, gums, right? So there's a direct correlation between the two. So it involves extensive study, not just of the mouth, but the whole body, because dentistry is a specialty in medicine. So you need to also know your stuff very well. And for you to be a very good dentist, it requires a lot of discipline. You need to know what you are doing. When a patient comes to you, for example, the patient is not just the mouth, but the entire body. And you treat people the same way you'd want to be treated. I always talk about being empathetic. Do unto others as you expect others to do unto you, because obviously the tables can turn as well. So when you see a patient, don't just treat them anyhow, but give them the best. What you want for yourself is what you give your patients as well. So when the patient comes in, make sure that you're looking at the patients from hair to toenails. You'll be taught in dental school. You have to make sure that you're looking at every single part of the body, right? Because when they're coming in, the way they are walking can also help you with their medical history, the way they talk to you, the things that they do can also help with their social history, right? So you need to make sure that you check in everything very well. So you see the patients from a holistic, broad view or approach, and not just the mouth, right? So that is how I do. That is how I treat my patients. And I'm loved by my patients because I always ensure that I give them the best, and I'm very patient with them.
Excellence. Yeah, it's all about excellence in patient care, and that's you're patient centric at this point, and that's so important. Dr. Oliveira, I think on behalf of Mary, I'm curious too. In your studies, and when you said that when you went to school, you would also go to clinics and make sure that you had some time there. Did the experience in being in the clinics help you with referrals onward? Did any of that pay off for you in terms of advancing your career and them making referrals to you? And as far as scholarships goes, what advanced you toward those scholarships? What helped you to get those,
Okay.
other than the hard work we know that would take into studies? But yeah.
Clinical observations, I call them.
Yeah.
From the very beginning, that experience going into the dental clinics, observing, helped me to, so I didn't really get referrals because I was quite young by then and I hadn't established my own clinics by then, right? However, interacting with different doctors, different nurses, different receptionists, and so on and so forth, gave me a broader view, right, as to what I really wanted to do. So, and also, obviously, when it comes to getting recommendation letters, because I worked in the various clinics, even though it was on observational level, I still got good recommendations, because even though you are studying, it's like doing this as on, it's like an extra sort of like points to you, because your colleagues might be maybe sleeping or partying or whatever, but you are there right after school working, not really working, but then doing something else within your field. Do you get it? So I got a lot of recommendations that helped me later on to advance in my career. So I would say that, for example, I studied in Bath in the London School of Medicine and Dentistry, Queen Mary's University of London, and I came out really well. I got first class honors, and I got very good recommendations right from Brazil, right? So right from Brazil, I got all these good recommendations that helped me to further go to Bath in the London School of Medicine and Dentistry, where I excelled. So I feel that for Mary in particular, and everyone listening to me, what you do in the beginning always matters, right? Always aim, have a goal, and always make sure that you work according to your goal or mission.
Mm-hmm. That's good. That's good advice. Mary, do you have a follow-up question on that?
Yes, I would also love to ask what else, Dr. Emma, are you doing to help the young people like myself to achieve or venture into that line of work, dentistry?
Okay. So what I do is that I have a few NGOs, and then also I give opportunities for internship, because if I hadn't been given that opportunity for internship, I don't think I would have been where I am today, right? So I also do internship. I give a lot of opportunities, not just, in my clinics, and also in the other clinics, I recommend young dentists or young students to, I give them recommendation letters. I'm really, really good at that. So to go in there and then, have that experience as well. So for somebody like you, as well as the others, I can easily give you a recommendation letter, or for you to observe, because learning through observation is very good. It equips you with the needed knowledge and experience. I always say experience, right? So it gives you the needed knowledge and experience and skills to move on. So I do that. I offer all these things to people as well. And also, I have NGOs. I think you've heard of them already. There is one called Hearts for Health. It's an NGO aimed at providing healthcare services to underprivileged people in the society. And we've helped over 10,000 individuals. There is also building confidence. I always say that, building confidence, one smile at a time. And it's aimed at providing oral health education to underprivileged people in the society. So a lot of people that wouldn't have been able to have access to oral health care, through some of these NGOs and initiatives, we're able to serve them, and they become so grateful.
That's terrific. So impact as well as business, and that's what we're all after. So I want to kind of turn now to some of the work that you're doing. You mentioned the Caribbean, that you're doing some work there, and how you're approaching that. Uh, from the standpoint, you mentioned that how oral health correlates with heart health, and I think that's really interesting because we do know in the Caribbean, people die of heart disease more than they do anything else. And even though it might not be directly related to oral health from the standpoint of when they die of heart attacks or heart disease, certainly oral health will impact that in some ways. So it's interesting that you zeroed in on that. Very smart of you to do so. You want to talk a little bit about that, and then the Beyond Waves, the Brazil connection with Ghana. So tell us a little bit about that.
Yes. So the works that we're doing with the Caribbean, it's not just in Caribbean, we're also doing it in Europe, so Italy, and then obviously in Salvador, Brazil. The initiative is called Beyond the Waves, right? The reason why we chose the name Beyond the Waves is that Brazil to Ghana, there is the Atlantic Ocean that divides the two countries or the two continents. And so going beyond the waves, maybe moving from the African continent to Brazil, to the South American continent. You are going beyond the waves. So that is where the name came from. And also not just to South America, but also to the Caribbean, because once again, the Atlantic Ocean divides the Caribbean from Africa. So you're going beyond the waves. Now, the work that we're doing in the Caribbean, we've chosen 3 particular countries, St. Lucia, Grenada, and Dominica, right? So we're setting up health facilities, not just dental clinics again, but medical centers also. Optometry, eye clinics. We're also looking at ear, we're looking at pharmacies, we're looking at the whole health facilities in general. And we chose these 3, we chose these 3 particular places because the return on investments for these places is remarkable, and also for taxes. So there is tax relief. We help to get tax relief as well. And so it's going to be very good for people who are, businessmen, once again, or businesswomen, and also people who want to own their own clinics. And in the Caribbean, the reason why we chose the 3 places that we've chosen, we're looking at a particular niche of in the community or in the society. We want to cater to we're not being biased though, but it's just that I'm always trying to sort of like experiment, do other things, So for the Caribbean and these 3 particular places, we're looking at luxury health or luxury dentistry. So our health facilities are going to be luxurious, right? Still maintaining that quality services that we provide, right? But you're going to be very high-end, beautiful. It's all about luxury because and I'm calling it my luxury dentistry or luxury healthcare, because there is, with dentistry, just before we move on, with dentistry, you could, like, for example, you could have the most beautiful clothes on, most beautiful face, but if you're missing 2 front teeth or 1 front tooth, everything else changes. So dentistry is fashion, dentistry is beauty as well. And so I'm trying to merge that also and creating that not just in the Caribbean, but also in Italy and elsewhere. So
the teeth whitening industry has really set the stage for that. So yes.
Yeah, teeth whitening industry has really set the stage for that also. And obviously we have other more advanced aesthetic procedures like veneers that can also be done. Yes. So yes. So now for Italy, for example, we're trying to work with the Italian Chamber of Commerce, right, to help people who want to invest in projects, right, to get sort of like tax waivers and reduce, a lot of opportunities for them. So we're working hand in hand with the Italian Chamber of Commerce to ensure that whoever invests in our projects at the end of the day will make very good money. And for Brazil, we've chosen Salvador, which is a state in Brazil. Brazil is so big, extremely big. There's a state called Salvador. Salvador is located in the northeastern part of Brazil, right? And it's got a predominantly Afro or Black origin. So there are a lot of Afro-Brazilians there. And it dates back to Africa, West Africa, for example, so Ghana, Nigeria. So you go there and you have that beautiful West African culture there, including some of their religions also. And Salvador, the governor of Salvador, is working hand in hand with us to ensure that we bring in investments. He wants to boost the Salvador economy or Bahia economy. So we're bringing in a lot of investments to that area, right? And once we are working with him, everything is going very smoothly. And we are ensuring, we even have an upcoming program in January. It's a 10-day package whereby people and investors we're combining it with tourism. So even though we'll be taking you to all the beautiful tourist sites, we'll be having seminars, conferences, right? And then introducing you to the key stakeholders in that area. So we have a 10-day itinerary whereby once you get there, there's an introductory section. We'll take you. We have even legal houses. So we have legal practitioners there who are ready to work with the people that we take there to help them legalize if it's migration that you want, if it's setting up clinics, if it's setting up businesses, if it's about real estate. They'll walk you through the legal requirements. So documentation's needed, help you to set up, right, without any issues whatsoever. We want to make it very flexible for people who want to invest there. And our 10-day package is designed in a way that is going to be remarkable. You're going to enjoy your stay there with us and also have extensive knowledge on the various business opportunities that await you there.
You've got your hands in so many things. I don't know how you do it all. Where's the next stop for you? Where are you headed next with what you're doing?
So for me, I always say that I don't have any limits. A lot of people say the sky is your limits, but for me, it's the universe. The universe is so vast. So I don't have any limits at all. And where I'm headed, I want to go globally, explore as many places as I can, and expand across the globe. Mm-hmm. So for me, I'm going to expand across the globe from one place to the other, spread my wings, and just ensure that I'm known everywhere else and provide quality services to people just all around me.
Well, you know what, Mary? I think you've got some content for your book. So I think you've got somebody you can, use a quote or two from there. Before I get Mary, I'm going to give you the last question, or we're here in a minute. But the last question I have for Dr. Emma is, who do you need to meet to help you move progress around in these many things, these many areas that you've got your fingers into?
Okay, so I have a saying, okay, which is even on my WhatsApp, I think status, or no, not status, my profile, and it's called, I am daringly showing up to contribute something beautiful and meaningful to this world. So whoever is ready to help me achieve that, please bring them to me.
Okay. Can you be a little more specific? So help me with that. Okay. If you had to pick one type of person, let's say maybe for your Caribbean work that you're trying to do there, is there any particular type that you're looking for?
So for the Caribbean, what I'm trying to do there is establish, clinics, because that's my specialty, right? And
Yeah.
so if I could get somebody, and then real estate. So we're looking at clinics and real estate. Now, one thing I'm also looking at, which I forgot to mention, is that I'm merging clinics with real estate. So and I'm working with somebody here in Ghana. I'm yet to have a meeting to finalize it. For every real estate property or for every building that is set up, right? We want to provide like a mini dental spa. So that's how I'm going to call it, a mini dental spa. So every yeah, so for every how do you call it? For every development done. So let's say for maybe one development is done in one area, for example, right? We'll provide a mini dental spa. The mini dental spa, you get to have besides obviously dental health services, you also get to have a massage done for you. You also get to have like a pedicure, manicure. So whilst you wait to be seen, we can provide these services for you as well. So you are comfortable
Love that.
and
You
not
get
really
everybody all nice and
anxious,
relaxed.
nice and relaxed. Because a lot of people come to the dental clinic quite anxious, and when they are in the queue waiting to be seen, they get really agitated. So the idea is that don't let them get agitated. Let them be relaxed. Let them sit down, enjoy some massage, some mini pedicure, manicure, take some coffee, and then just relax, waiting to be seen, right? And so for the properties that are being developed, we want to provide that. And it also helps us to advocate for dentistry because it's an area that people really don't explore. And they always end up associating it to pain. And once you take their minds off that pain, dentistry is not about pain, it's luxury, it's beautiful, right? So for every property that is developed, we want to ensure that we have that beautiful setup there as well. And so for the Caribbean, that is something that we're looking into, merging the normal real estate with dentistry, making it dental real estate and medical real estate. Yes. So merging that. So for all facilities, whether it's a hotel, whether it's a commercial property, whether it's residential or wherever, we always want to have a small area to set up a facility, a health facility like that, of that sort.
That is really interesting. And I could see that happening with large resort hotels, co-location services. Because, the one thing that I know, even in the United States, is most people here have to travel a bit to get to their dentist. And it's kind of like anything else, like your doctor is your doctor. You don't have to change your doctor. You really don't want to have to, change your dentist and that sort of thing because you get to know them. But when you're traveling or you're vacationing, a toothache is not going to wait. It is just not going to wait. And it will not get better all by itself. It has to be addressed. I had the occasion, I don't know if you're not going to know the name, but Geraldo Rivera was a famous reporter around here. He's been on all over the networks this is years ago. Anyway, where I live is on a little island, and he came in he flew in, had his crew meet him on his little yacht, not far from where I live. And I was working on a film festival at that point in time, and I got knowledge of him coming in. So I went over to ask him for an endorsement for that film festival. And I'm 5'4", and I think he was shorter than me. So, so I was like eyeball to eyeball, or almost to him. He was getting ready to board his yacht and said he was getting ready to head off. And he was heading to travel south towards Florida from where we were. And he was complaining. He kept putting his hand up on his jaw. And I said, "What's wrong?" And he said, I think I'm getting a toothache. I said, "Well, I tell you what, you better get that addressed before you get on that boat." And the mother in me came right out. It's like, I'm always looking. You cannot get on that boat without getting that address. I want you to know it wasn't. I don't even think it was 2 days before I read in the news that his boat had to pull off in Florida somewhere. They didn't say why, but I knew. I knew why. But I'm like, oh yeah, I kind of think he had to look for a dentist like right away. And by then it was probably an extraction situation or some kind of, really, get me off this boat and get something to happen, right away type of thing. So you can't mess with those things. So I do get what you're saying is wherever it is that you are, you have to get those things taken care of. But so I like your idea very much. So back to the question of who you need. It sounds like you need partners, you need investors, you need people in real estate in the Caribbean, maybe. all of the above. Yes, am I right?
Yes, you're absolutely
Okay.
right. So I'm looking for
Okay.
partners, I'm looking for investors, I'm looking for sponsors, and not just in the Caribbean, but also in Europe, especially Italy, and where we are also exploring, and obviously in Salvador, Brazil as well. So yeah, so I'm looking for all of these
All
people.
the
So whoever
above.
is available, please get in touch
Hey,
and let
big
us create
dreams,
something.
but you don't get unless you ask. So it's good for you to be out there doing that. So this is awesome. I'm going to give Mary the last word of comment and or question. So Mary, what you got?
Um, I would just like to say I'm really inspired by Dr. Emma's work. Very motivated, and I would love to be like her. Thanks.
You have a mini me. Yeah, you've got somebody who's wanting to use you as a role model. I expect you'll be in touch with Dr. Emma about maybe getting that letter of referral so that you can go be in maybe some of these clinics and observe. I think that'd be a great opportunity for you and start making relationships that can maybe refer you out for these scholarship opportunities that you're looking for. I'm sure will be a very good thing. So, and last question, Dr. Emma, where should she be looking for scholarships? Where is the best place to look for scholarships for these types of things?
The best
For these,
place to look
for this type of education?
for this type of education. And okay, so on LinkedIn, I think on LinkedIn is one of the places that you could search for. And also, if you do an embassies, for example, the Brazilian embassy in Ghana, scholarships to study in Brazil, and they offer scholarships for so many courses, medicine, dentistry, etc. Right? So you could look at opportunities from the embassies as well. And I know that in Ghana, the British Council also has it's got a grant and then some sponsorship opportunities also, right? But then I'll get your number and then get an actual list for you so that you can explore those ones also. Okay.
That would be wonderful. Thank you so much, Dr. Emma. I appreciate it.
Thank you.
And thank you, Mary, for being with us. So if you guys stay with me for just a minute, I'm going to say goodbye to everybody else. If you're hearing this podcast on one of the many places that you listen to your podcast, go to frontrunnersdevelopment.com where you'll get to see this and maybe some links to how you can communicate with these folks here today. So again, thank you. And we'll see you next time on Front Runners Innovate. Bye-bye.